Today, the healthcare industry is witnessing a profound shift driven by digital transformation and integration of artificial intelligence. Hence, emerges the need to make the move from just providing healthcare to the promise of digital health for all. Against this backdrop, the two-day mega Global Digital Health Summit, Expo and Innovation Awards were organized to discuss and showcase how innovations in AI and digital transformation are shaping the future of healthcare by bringing together leading experts, policymakers and innovators from around the world. This year's theme was Digital Health at Scale Success Stories. Summit co-chair Anne Mond Johnson, CEO, American Telemedicine Association, and Dr. Rajendra Pratap Gupta, Chairman, Global Digital Health Summit, opened the Global Digital Health Summit 2024 to set the tone for the future of healthcare.
I am deeply grateful to Professor Gupta for inviting me to co-chair this Global Digital Health Summit. The United States is not nearly as big nor as populated as India, but we share many of the same challenges you face in healthcare. That is why the theme of this conference, Digital Health at Scale, is so compelling. Operating digital health at scale means that we'll be able to meet citizens where they are with the high-quality services they need, achieving the best possible outcomes at an affordable price point. You can have the best technology in the world operating at scale, but citizens and clinicians must have the confidence to use it. Using digital health, using technology to reimagine how we can meet people where they are is our opportunity and our obligation. Dhanyavad.
Healthcare delivery will move from 4 walls to 5 fingers, and we are seeing that happening as we sit in this room. That's a reality. This is not the age of competition. This is the age of creation. And that is what digital health is about. If you believe in just competition and incremental gains, you're not going to last this race till the end of this decade. And there are no digital health tools. There are only health tools. So do not divide digital from health. It is integral. So let's understand one fundamental thing. All the people that you see outside there are health tools, not digital health tools. And technology will drive healthcare, and patients will drive technology. If you're still not in digital health, you're already late. Thank you so much.
Moving on, Global Digital Health Summit has always put patients first and gives real consumers, the patients themselves, an opportunity to take the stage and share their perspective loud and clear. This is what they had to say.
My request to everybody out here, as patients, doctors, caregivers, ask questions. You are entitled to answers and you should get them. To doctors and other caregivers, please share information.
The persons like us need support, medicine, counseling, and lot of self-confidence. Patients like us, like schizophrenia patients or any mental illness patients, needs your support. They just want your 2 words that you can do it. Yes, you can do it, and you have done it.
Acceptance is the key, be it self-acceptance or societal acceptance.
My kid is physically challenged, and I see everywhere in this journey, people, come up to help them and try to, make it notice. Maybe it is out of concern, but then they don't need sympathy. They ideally need empathy and support. Take them as equal, give them all the opportunities possible for them, and it will help them to grow.
You are stronger than this disease. You are so stronger than this disease, and every day of your treatment brings you closer to the victory. Please never give up, never lose your hope. One day, definitely you will win, and TB will lose. Just complete your treatment.
Doctors should please talk openly to the family what will happen so that the family can take care of the patient nicely.
Healthcare system should be driven with technological advancements and professional support.
मेरी बच्ची उजाला कुमारी है जो थैलेसीमिया से पीड़ित है आज मेरी बच्ची का जो भी ट्रीटमेंट हुआ तो चाइल्ड हेल्थ फाउंडेशन के जो भी कार्यकर्ता है उनको मैं धन्यवाद देना चाहता हूँ। ये चाहूँगा कि जो भी ये टीम बनी है ऐसे ऐसे बच्चों के लिए ये टीम कार्यरत रहे, ताकि मतलब हम जैसे असहाय की सहारा बन के और बच्चे का जीवन उज्जवल बनाए। इसके लिए बहुत बहुत धन्यवाद चाइल्ड हेल्थ फाउंडेशन को।
Next up, we have an address by Nobel Peace Laureate Professor Muhammad Yunus sharing his take on technology's potential to make healthcare accessible for all.
The Global Digital Health Summit represents a beacon of hope, a platform where innovations, technology, and compassion converge to address one of humanity's most pressing challenges. Digital health as a concept is a revolutionary force. It has the power to transcend geographical boundaries, overcome socioeconomic disparities, and bring quality healthcare to the doorsteps of even the most marginalized communities. From digital consultations to robotics, AI-driven diagnostics, we are witnessing a paradigm shift in how healthcare is delivered. This is not just a technological evolution, it is a profound transformation of how we perceive and approach human well-being. So we can address all the human problems and solve them in a business way, in a social business way. We must remember that technology alone is not a solution. It's a tool, a very powerful one, but it must be wielded with wisdom and compassion. It must be driven by empathy, understanding that behind every data point there is a human life, a family, a community. Let us build a future where health is not a privilege but a universal right, where technology serves humanity and not the other way around. Health is not just a fundamental right, it is the foundation upon which we build our dreams and aspirations. Without health, we have nothing. Dr. Gupta has made phenomenal contributions to advancing this field, and under his chairmanship of this global summit, together, let us make digital health the driving force for a more just, equitable, and healthier world.
For the next session, some of the most esteemed leaders from around the world discussed and highlighted the adoption of digital health on a global scale.
Digital health has been around for quite a while. The current digital health landscape is often characterized by point solutions, by fragmented solutions, by ad hoc solutions. Let's think about new and additional ways to finance digitally enabled health, where we also combine the financing of digital health and digital public infrastructure with value-based healthcare elements.
I'm pretty sure the changes to analog to digital will become soon, like in 2 years or 3 years. It will come soon, very quickly. So to do that, actually we need to prepare the changing, and then actually based on the changing, actually the government support also required.
Following that, in an inspiring keynote, Mark Jones shared his visionary insights into the future of digital health and the role of technology in transforming healthcare systems.
I do think it's important that we all, in all of our organizations, we start thinking about how do we reinvent healthcare, and in doing so, how do we reinvent each of our organizations? Healthcare is not special from that perspective, in that technology has forced just about every industry to face the urgent need to rethink, redefine, and reinvent itself. The world, however, healthcare is in the midst of a remarkable transformation, in my opinion. As the World Health Organization has identified some key technological advancements, AI, virtual reality, 3D printing, and gene editing, the increasing burdens of chronic diseases and unequal access to care They pose significant hurdles to our economic and personal well-being. So what do we do about it? Reinvention. While that's easy to say, it's not going to be easy to do. We can't reinvent healthcare as an industry. We have to reinvent healthcare organization by organization. As we think about reinvention, it becomes very important that we do that with the patient in mind. How do we improve our organizations? How do we improve our industry to provide fair, equitable health for everyone on our planet? What needs to be done to reinvent ourselves? And there's really three key themes. First, and perhaps most importantly, is the need to understand your core competitive advantage, its core strength. What is your superpower? The second theme is creating a culture that supports innovation and change. And the third is to understand the value of timing.
Today's digital age presents tremendous opportunity for doctors to adopt digital technologies that enhance outcomes and optimize resource utilization. To discuss this opportunity further, the most prominent leaders took center stage.
It's very important that you think about AI solutions in this context specifically. They're not a replacement, they are a tool. The three key learnings that I hope you can take away from this particular session. One is that current and future clinicians are very excited about the capabilities, but also see major challenges that we need to overcome. Trust-based design and high-quality content are critical to ensure and to really rebuild and shape and build on the trust. And we also, when you start to use these tools, it's really important to not have the clinicians, the students, just take everything for granted. It's important that we have solutions that can drill down into the evidence and then teach them how to challenge these evidences and constantly improve that cycle.
Today's topic, preparing doctors for digital age, is crucial because in today's time, doctors need to have clinically competent and technically proficient. Doctors need to be trained and they need to upskill themselves in digital health. Today, patients are more aware. 6 out of 10 patients know digital health and only 2 out of 10 doctors know digital health. So in 2019, we started Academy of Digital Health Sciences. We train hundreds of certified digital health professionals. These professionals have an average of 20 years of experience. Today, they are more aware and they know the complete ecosystem of digital health. So let's get trained and upskill ourselves in digital health.
Next up, a panel of experts discuss the role of technology to manage and reduce the chronic diseases management spending in the healthcare.
1 in 8 kids in India has at least one neurodevelopmental disorder. We are talking about 3.5 crore kids in India who have this problem. For these kids in India, you have only 20,000 speech and occupational therapists, which is grossly inadequate. What we also really hope is that because we are collecting data from every single touch point, every single day, from a lot of kids, we want to publish this to set benchmarks for improvement in pediatric therapy in India.
So close to 1 billion individuals are suffering from sleep apnea. So we at ResMed, we have 2 particular apps. One is the patient engagement app called the MyEar app, which provides personalized coaching and engagement to the patient, right from troubleshooting to coaching on different aspects of the device and the therapy. And at the same time, we have a remote monitoring app, which we call as the AirView software for HCPs to actually monitor and prescribe and to change the prescription on their device.
Welcome back. Moving on, we have Dr. Devi Shetty, Chairman and Executive Director of Narayana Health, emphasized on the quality of healthcare and the need for innovative solutions for patient care.
India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy. We produce the largest number of doctors in the world. We produce one of the largest number of nurses, medical technicians in the world. We are the pharmacy of the world. We have every ingredient to dramatically transform the healthcare. There is only one missing link. And that missing link is people do not have the money to pay for the healthcare. We have to come up with a solution. And that solution didn't come from the doctors like me. It came from the patients. The truth about Indian healthcare is Indians can't afford cost of healthcare, but they can afford the cost of affordable health insurance. And this is the foundation on which healthcare and health insurance can be built.
In the following fireside chat interaction, Dr. Shetty focused on the need for providing quality medical education domestically and the adoption of digital platforms to save healthcare costs.
Every year, I think we have over 25,000 young Indians undergoing medical education in most of the former Soviet Republic and China and different parts of the world, where they really don't get quality medical education. It costs them between 50 lakh rupees to 75 to 1 crore rupees. So instead of allowing these doctors, students to go abroad, we have hospitals with 500 beds, 1,000 beds with amazing infrastructure. Just give them the license to start like an overseas medical college. And the government can easily monitor the quality of education. I believe the cost of healthcare will go down. But the number of patients who will access healthcare will dramatically increase. And the number of the throughput of the hospital will increase by 3 times to 4 times. And that throughput cannot increase without digitization, without a digital platform.
Next, a session from true mavericks, disruptors and innovators shared their experiences and perspectives on digital health. The following session explored how advancement in IT and medical technology can be leveraged to generate revenue and enhance financial health of hospitals.
First of all, digital health wave in India is speeding up. Secondly, there's a fork in the road for hospitals. They're at a crossroads right now, and they need to decide which path they're going to take. And if they choose correctly, then they can become the hospital of the future, which would be a visionary and profitable institute. And technology can be the vision enabler during that journey, because that journey will be full of challenges, but technology is there to hold your hand along that journey. I hope that we're able to, come together to enhance sustainability for hospitals, but also healthcare systems around the world.
So now as a Samsung, we have a range of solutions, apart from the MedTech. But we have mobiles, we have monitoring, we have display, and it can be combined in order to script a profitable solution for each and every institution.
The session on screenings and diagnostics in digital age discussed how technology will play an important role in the evolution of screenings and diagnostics.
In today's world, we need the convenience of something at home. So what we are next working on is how can we have a wearable which essentially is going to have the same images of the retina being taken and also having this being given in the convenience of a home. That's going to be more from a prognosis and a diagnosis, not from a diagnosis perspective alone, but from a monitoring perspective.
Then it was time to catch the integrations of AI and the latest technologies by innovators who seek to revolutionize the continuum of care.
As WHO, we prioritize the opportunity that digital health presents us to improve health outcomes more effectively. Everyone in the room today has likely had some experience with AI-based tools in your everyday professional and personal life. AI is going to be embedded into the future of global health and our collective future as a society.
Science games we have
become one of the world's leading health game companies. Our vision is to improve health of 1 billion people by 2030 through games for awareness, diagnosis, and therapy. So why games? Well, games are about habits. Habits are our unconscious thoughts, emotions, and behaviors. Games are engaging, long-lasting, they have high reach, they are measurable, and you can reach huge audience with games.
The next session was on the future of surgery, where eminent speakers discussed the critical role of technology adoption in preparing surgeons for the future.
Okay, so I've been given the task to talk about the future of surgery, which is close to my heart. And I would tell you about the concept of digital surgery. A new concept really over the last 4 or 5 years, enabled by the technologies that are powering our society. This is a depiction of the future of the OR, with 3D printing, AI-driven tools, MRI CT being superseded by other technologies, with remote robots, connectivity. So the world is going to be exciting for the world of surgery.
Can we stay still humans and advance surgery in the future? Surgeons will continue to be the central decision makers in the operating room, considering not only the quantitative data provided by technology, but also the qualitative aspect of patients' care. However, my take is on surgeons and AI, a great combination.
I will make 3 points. Number 1, innovation and technology have always mattered. Number 2, surgical technology is improving the quality of our lives. And number 3, transformative digital innovation requires collaboration. That if you want to go fast, you have to go alone, but if you want to go far, let's go together.
The transformative event had a special keynote address by Bernardo Mariano Jr., who explained transformation and innovation in the healthcare space.
We have the power of technological innovation and collaboration in our hands. Yes, your hand, my hand, our hands. By bringing together experts from diverse fields, we can create solutions that are not only changing lives, but are also shaping the future of healthcare. And remember, technology is not just a tool. It is a partner. It is a force that can elevate human potential and improve healthcare outcomes. But also remember, with great power comes great responsibility. As we navigate this digital frontier, let's ensure that technological advances are human-centric, are driven by compassion, accessibility, equity, and inclusion. We are shaping the digital future for generations to come. Together, we are shaping the healthier tomorrow. Let's do it.
In addition to the conversations, Global Digital Health Summit also recognized significant strides in digital health. Through thorough research and post-distinguished jury evaluation to felicitate individuals who made an impact, shaped the field, and drove innovations that have greatly enhanced the adoption of digital health. Next up, in an exclusive masterclass with global leaders, industry professionals got a chance to get answers for their questions and gained valuable insights and explored the future of this field. To explore the intersection of nursing and technology in modern healthcare, the National Nursing Summit on Digital Health was hosted at Global Digital Health Summit 2024 in collaboration with Indian Nursing Council. The event emphasized the critical role nurses play in driving digital transformation within healthcare settings, from improving patient engagement to streamlining workflows and enhancing clinical decision-making. Moving on, to discuss the role of digital technologies in the mental health and human rights, National Scientific Symposium was organized in association with National Human Rights Commission, IHBAS and IAPP. To discuss next-gen digital health solutions, the workshop was organized together with Google Health and Google Cloud, hosted by Health Parliament. This workshop served as an opportunity for developers and senior enterprise executives in healthcare to learn about Google's latest advancements and technologies in the digital health space. Next week, we'll continue with the exclusive coverage of Global Digital Health Summit, Expo and Innovation Awards only on ET Now.